Hello, and welcome to Care Talk. My name is Laura Packard, and we're here to answer your health insurance and healthcare questions. So please text or call in your questions at 202 838 6837, and we'll answer them in future episodes. And also be sure to subscribe to my channel on YouTube or podcast, wherever you get your podcasts for future Care Talk updates. And now it's my pleasure to introduce Dr. Meena Bewtra from Doctors for America, who's going to be talking about some of the nominees for healthcare agencies for next year and what they mean for our public health. So welcome, Dr. Meena.
Thank you so much. I am incredibly honored to be here because this is a really important topic that affects every single one of us. And I'm going to be focusing today on Robert Kennedy Jr. and Dr. Oz because the two jobs for which these two are nominees are so vitally important to the public health of every single American. So I want to actually take a step back, though, and say, what are the jobs that these two are up for? Well, RFK Jr. is being nominated for the head of Health and Human Services, HHS. And HHS is focused on protecting public health and providing human services. So it shapes our health policy. It manages public health crises, think about COVID, but also littler things that like the salmonella outbreak we recently had, the listeria outbreak that was happening in deli meats. And honestly, when we don't have a public health crisis, it is because HHS is working in the background, preventing these from becoming something that actually affects folks. HHS also administers federal health and human service programs, and it oversees the Centers for Disease Control, the FDA, CMS, the NIH, National Institute of Health, the Substance Use and Mental Health Service Administration, and the Administration for Children and Families. Now, Dr. Mohamed Oz is actually nominated for the head of CMS, Centers for Medicare and Medicaid Services. This is one of the most critical human service agencies in the United States. It oversees healthcare programs that affect over 160 million Americans. These include those under Medicare, Medicaid, the Children's Health Insurance Program, or CHIP, and the health insurance marketplace. So the ACA, Obamacare, PPACA, whatever you want to call it. If you think about the folks who fall in the spectrum, these are often the most vulnerable, and these agencies critically need to be based in evidence-based care, not fraudulent therapies. So why are RFK Jr. and Dr. Oz so dangerous? The bottom line is this. Both have profited to the tune of billions of dollars off of selling disinformation, and I am not exaggerating about this. In fact, Dr. Oz has been investigated by the FTC, and it's estimated that he has scammed the public out of over $50 million by selling fraudulent products on his TV show, The Dr. Oz Show alone. His net worth is over $100 million, mostly from selling unproven products based on pseudoscience. And while he undermines vaccines and other science evidence-based therapies, he actually has made millions from various pharmaceutical companies. In fact, over half the claims that he has made have been proven to not be supported by any scientific evidence whatsoever. And there have been a number of lawsuits, hearings, and trials that have exposed him and his companies for using false claims, bogus testimonials, and fake websites. Couple of examples. During the COVID pandemic, his website promoted, and it still promotes, last time I checked a couple of weeks ago, hydroxychloroquine, despite no scientific evidence supporting its use. He has also promoted unproven treatments for cancer. This is incredibly dangerous and can lead to death in patients. Now, moving to RFK Jr., very similar story here. He has spent over 40 years destroying science, public health, and amplifying harmful conspiracies. And in doing so, made millions and millions of dollars from this. He's especially well known for promoting completely false and fraudulent claims about vaccines, but he has also fabricated and profited off of anti-agricultural disinformation. He is the founder of one of the most powerful and dangerous disinformation organizations called the Children's Health Defense. It sounds really lovely, like it's giving the impression of trying to protect people, when the truth is that CHD has eroded trust in vaccines, fluoride, foods, and much, much more. And claims by the CHD have repeatedly been proven to be false by scientists and doctors. And they make a ton of money peddling this disinformation. It's estimated in 2021 alone, during the COVID pandemic, they profited off of spreading disinformation to the tune of about $16 million. To give you a real life example of how dangerous these two are, I want to talk about Samoa. If you haven't heard about Samoa, it's a perfect example of how the spread of mis and disinformation can kill countless people. So in 2018, there were 2 infants in Samoa who died from a real administrative error in giving the MMR, the measles, mumps, and rubella vaccine. RFK Jr., again, heading up this children's health defense group that is anti-vaccine, seized this moment. He actually flew to Samoa. He used the tragedy to promote anti-vaccine disinformation. He even publicly wrote to the Samoan prime minister, urging him not to vaccinate his people with the MMR vaccine. And in 1 year alone, following this campaign, MMR vaccine rates dropped from 74% to 31%, over half less, leading to a measles outbreak in Samoa. That measles outbreak killed 82 people, mostly children. It caused sickness and permanent damage to thousands more. In fact, it was estimated that 3% of the Samoan population was infected. 20% of infants under 1 year of age got measles. 1 in every 150 babies died, and over 90% of deaths were kids who were under the age of 15. RFK Jr. has never accepted any responsibility to this or admitted he was ever wrong in any of his claims about vaccines and what happened in Samoa. The bottom line is that this could happen over and over and over again across the United States, because these two are taking over agencies that are so vitally important to fighting misinformation and ensuring public trust. And instead, they have a long track record of exploiting people's vulnerabilities, exploiting real medical anxiety that we all have, and using this fear to make millions off of peddling pseudoscience and destroying real science. And this can lead to very, very avoidable death and very, very avoidable harm. So this is incredibly scary. And the good news is we all have a little bit of agency in preventing this. We have to remember that they are still nominees, and we can all call our senators and tell them not to promote, not to vote for these two. It will quite literally affect the health of every single one of us in this country.
Thank you, Dr. Meena. And speaking as a cancer survivor, I know that when you're going through something serious medically, you want answers. You want to believe there's things you can do that you can control. And I can understand how it could be appealing that somebody says, there's these things that you're not hearing from science about. But I think it's really important in that our health and our lives depend on getting accurate information from our elected officials and from the people who are in charge of our country's health. So what do you think could happen if we have somebody in charge of America's health that is not in contact with reality?
I am incredibly scared and worried about it. And I'll say, I want to back up what you said. Yes, absolutely. People have real medical anxiety all of the time. And that is exactly what RFK Jr. and Dr. Oz have made their careers off of taking advantage of. They will, what they start off by saying is, oh, we need to have safer water. We need to have safer food. That is absolutely accurate. There's nothing wrong with that. Then they start to push it a little bit further. Well, we have these rising rates of autism, and we worry about vaccines and causing autism. Well, what the truth is that there have been countless other studies showing that there's no connection whatsoever between vaccines and autism. And it is fair to look into autism. It is fair to want to examine what is causing this, or maybe what we can do about it, but it is not vaccines. It is frightening that they purposely go after proven science in order to make a profit, because that proven science will hurt not just the folks who don't get vaccinated, but all of the folks around them. Things like vaccines, things like medicine, things like public health, they don't just affect a few people, they affect everybody. And that is how pandemics spread. That is how we have these outbreaks. And if we don't have trusted officials who are willing to understand science, who are actually trained in the field, and who surround themselves with trained professionals, then everything from the safety of our food and water to the safety of our health care is at jeopardy.
Thanks. And I want to echo what you just said. It is fair to have questions about our food system, our waters, the food that we eat. You know, we live in a country where food is increasingly industrialized, and there are additives that maybe we should have questions about. But I think it's important to separate these basic questions that, yes, we should know what's in our food and our water, what we put into our bodies, with this anti-science misinformation that is so dangerous. Like, how do you separate science from myth?
I honestly think that the first question you need to ask is, does this person have any profit in the answer? Because if they have a stake in pushing one side, then they're never going to be a fair adjudicator of what is and what is not truthful. Second, you do want a group of people who are unbiased and who are leaders in their field. And you want, just like you would not take your car to a place that has never fixed a car before, you would never take your relative to a doctor who has never practiced medicine. We shouldn't be taking the most important offices of the public health and healthcare of literally every single person in this country to a man who's not a doctor and makes billions of dollars off of peddling pseudoscience, or put centers from CMS in the hands of someone who has been investigated over and over again and shown to peddle fraudulent claims through the FTC and make money off of them. Those are not the correct people. They may be billionaires. They may have given a lot of money in campaigns. That does not make them good people to be in charge of these programs. Quite the opposite, in fact. And I think you want to really look at who are the people who are saying this, who are the people who are in charge, who are leading this, and then think about, who would I trust my own health to? Let's get a doctor who doesn't have a financial stake in any of these answers and any of these products, but who's truthfully somebody who's an expert in this field. That would probably be a good place to start.
And let's also talk about something I think that's been less discussed. Their pseudoscience and their anti-vaccine records have been, shared, but I'm not sure that people are really thinking so much about the size of these agencies. And what RFK Jr. and Dr. Oz are being hired to do is run agencies of tens of thousands of people that control healthcare as it's delivered across America. Is there anything in these two's record that would prepare them to be the CEO of giant corporations?
Absolutely not. Absolutely not. Neither one of them have any kind of track record for this type of overseeing any type of agency. They've never worked in any agency like this before. And it truthfully is frightening to think about not just how little expertise they have for the agencies that they are being nominated to, but how little expertise they have in running any type of agency that is so vitally important. And again, this is the health and science of quite literally every single human being in the United States. That is the truth. The policies that they will be in charge of, the people, the centers that they will be, agencies that they will be in charge of, are the ones tasked with monitoring and providing the health and science of every single human being in the United States.
And just to reiterate, what should people be doing if they have concerns about these nominees?
First of all, remember we all have agency in this. And second, remember your senators work for you. And I know folks who have worked in campaigns and have worked for senators, and they are not used to their constituents giving them a call. In fact, as few as 10 calls a day makes a really big impact, because remember, they have to log every single one of these calls. So call your senators, start now, and tell them that you do not approve of these people being in charge of RFK Jr. or of Dr. Oz's nominees, and that you are watching how they vote. Have your friends, have your family do it. Quite literally, your life is on the line here. And I cannot emphasize enough how important it is that we get in touch and make our voices heard. We all have agency here.
Thank you so much, Dr. Meena Bewtra from Doctors for America. And now I'm welcoming Louise Norris from healthinsurance.org to answer some of our viewer questions. The first question is about Marketplace Affordable Care Act health insurance. So one deadline has passed, but it's not too late to sign up for health insurance coverage for next year, right? Who's eligible and what do they need to do?
Right. You can still sign up. There's actually a handful of states where you can still get January 1st effective dates. But in most of the country, you're signing up now for February 1. But you can go on and purchase a plan if you already have marketplace coverage and you are picking a different plan. Your current coverage will automatically renew for January, and then the new plan you pick will take over and start on February 1. But yes, absolutely, you can do that. Start at healthcare.gov. If your state doesn't use healthcare.gov, it will direct you to the correct website for your state.
Thanks. And then we have a question from Mary from Blue Sky, who wants to know, are there any companies out there shortening the doctor payment pathway, essentially cutting insurance out as the middleman?
So this is, I think, a great question. And people like to imagine the idea that you can sort of, cut out the middleman of insurance. But the reality is, when it comes to significant medical situations, the costs are just too substantial for most private individuals to bear that burden on their own without insurance as a middleman. There are direct primary care models in which you pay a membership fee each month, and then you can go to this, a direct primary care clinic and receive, whatever preventive care, primary care, the stuff that clinic can provide you with. And they will have a list of what they can offer. And it varies from one clinic to another, but the key point is it's primary care. They are not going to be able to provide you with chemotherapy, with, when you start to think of things that are major medical events, you have a heart attack and you need open heart surgery, you have cancer and you need chemotherapy and radiation and, all those sorts of things, that's where you really need health insurance, because most people do not have hundreds of thousands of dollars sitting around to pay directly for their care. So if the direct primary care model is appealing to you, you can certainly purchase that in addition to your major medical health insurance. But the way healthcare works in the United States with the cost of significant care, you really need major medical health insurance.
Mm-hmm. And personally, I have a membership to a local dentist. So for things like cleanings, and that is included. But if you needed dental surgery, that's of course not included. And we should all have access to dental care as a part of healthcare, but that's a future episode. Our next question was a voicemail from David in Florida. He had to have emergency surgery a couple of weeks ago for appendicitis. Everything went well, but he didn't have health insurance. So the bill is over $100,000, and they're sending him a letter saying he can fill out an application to get a discount, but he's not sure how to fill it out, how to make his application look good. So want to talk about, first of all, medical debt, and second of all, applying for help?
Yeah, absolutely. And I would first want to preface this by saying, now is the time to get this situation sorted out for 2025. What's happened here is a a cautionary tale of what can happen really kind of in the blink of an eye if you don't have health insurance. You know, $100,000 bill being sent to collections. You need health insurance for 2025. Fortunately, open enrollment is ongoing, so you can sign up if you haven't already. Once you're already in the situation where you have a significant amount of medical debt, you can reach out to the hospital or medical facility that is billing you and ask for help. You can ask, hospitals will generally have a social worker or some similar job where they work with you to help you sort out the details of the financing. A lot of hospitals have charity care programs, but this is probably the situation we're describing here, where there's an application and you sort of have to prove that you need charity care. But again, you don't have to just fill that application out on your own. You can reach out to the hospital and ask their social worker to help you with the process of getting that application. There's a website called undomedicaldebt.org. It's UNDUE. And they have a tips and resources tab in the upper right corner of the page where they explain sort of the things you need to know when you're walking this path of medical debt. And I would say if you don't feel comfortable negotiating, asking for help, it's always a good idea to get a friend or family member on the call with you. Somebody who, get your friend or family member who's the best at like going to bat for what needs to be done, and ask them to get on a call with you, with the hospital, and talk to the social worker and see what can be worked out, as opposed to just saying, okay, I'll pay X amount every month for the next 20 years. See if you can negotiate that down before you start paying it.
Yes. And we had Marshall Allen on this show back a while ago, and his book, Never Pay the First Bill, also has some good tips for fighting medical debt. And our next question is from Lisa from Twitter, who wants to know why I had to get an approval letter through CareSource for my mammogram.
So mammograms are one of those situations where it can be, you might get it for free or you might have to pay for it. The approval letter itself might have just been the imaging center wanting to see that you had proof of insurance, or it might have been that your health plan requires a referral from your doctor before they will authorize the mammogram. So that could be the case regardless of whether you're going to have to actually pay for this mammogram. But so one of the things the Affordable Care Act did is made it so that preventive care is free, meaning you don't pay a copay, deductible, coinsurance. You just get the care for free on most health insurance plans, non-grandfathered commercial health plans. So that means employer plans or plans you purchase on your own. But preventive care is very clearly defined. And mammograms are an example of a service that can be preventive or diagnostic. So for a mammogram to be preventive, which means your health plan will cover the full cost and you don't have to pay anything. For it to be preventive, it needs to be on the regular recommended schedule and with no symptoms, nothing that's being diagnosed. So starting when women are 40, if you're, as long as you're not under 40, and assuming you're just on the regular mammogram schedule with no symptoms, your health plan will pay for the full cost, assuming you stay in network. And the imaging center may need a referral from your primary care doctor. But if you have a lump, if you find a lump or your doctor finds a lump, or say you have any sort of symptomatic issues with your breasts, you are going to be paying for that mammogram with whatever rules your health plan has. And this is true even if, let's say you're 42 and you've never had a mammogram, so you're past due actually for your first one, and you've never had it yet, and then you go in and your doctor finds a lump. Unfortunately, you no longer qualify for a preventive mammogram. You're now looking at a diagnostic mammogram. So with a diagnostic mammogram, you are going to pay whatever the rules are for your health plan. So this will be different with every health plan, but it might be your deductible plus coinsurance. It might be a copay for the imaging center, and then a separate copay or deductible for the, any other work that they do. But this will vary from one health plan to another. It's just important to know that whether or not you pay for the mammogram depends on whether it's preventive or diagnostic. It's the same as the rules that apply to colonoscopies. Those are sometimes free and sometimes not, depending on whether they're preventive or diagnostic.
Mm-hmm. Yeah, this was just reminding me of the question we had recently about the person that was charged for a colonoscopy and the exact same issue of, is it diagnostic or is it preventative? And our next question is from Elisa on Threads. Yesterday, a few days ago now, I got a message from my mom's healthcare provider system, Sutter Health, that as of January 1st, they will no longer accept her health coverage, which is Medicare Advantage through United Healthcare. No explanation. And the Medicare open enrollment period ended towards the beginning of December. So what does Elisa do? Is this even legal? What should Elisa and her mother be doing right now?
So fortunately, the Medicare Advantage open enrollment period is starting on January 1st. And it goes for 3 months. It's January 1 to March 31st. And it's only for people who already have Medicare Advantage. So it's not as wide open as the Medicare enrollment period that ended on December 7th. But if you have Medicare Advantage, which this is half the people with Medicare are on Medicare Advantage plans, this is another opportunity to make a plan change. You can only make one plan change during the Medicare Advantage open enrollment period. And if you make a plan change, it will take effect the first of the following month. So in this case, her mom could potentially have new coverage in place by February 1. During the Medicare Advantage open enrollment period, you can switch to a different Medicare Advantage plan that's available in your area, or you can switch to Original Medicare. If you switch to Original Medicare, you have guaranteed issue access to a Medicare Part D drug plan, but whether or not you will have guaranteed issue access to Medigap will depend on your medical history if you don't have a Medigap special enrollment period. There are certain situations that will trigger a Medigap special enrollment period. Like, for example, if your Medicare Advantage plan is ending altogether, that's one example. But Medigap special enrollment periods are fairly limited. So if you are healthy and don't have significant medical conditions, you can switch to a Medigap plan and it should be no problem. But if you have significant medical conditions, you should talk to either a local Medicare broker in your area or the Medicare SHIP program, which is a state health insurance assistance program for Medicare in your state, or call the Medigap insurance company that you're thinking about switching to and ask them, will they accept you given your medical history? Because what you don't want to have happen is you switch to Original Medicare and then find out you can't get a Medigap plan. Because Original Medicare does not have a cap on out-of-pocket costs. So there are, if you're in this situation and you're wanting to make a switch during the Medicare Advantage open enrollment period, I would really recommend that you find either a local broker in your area or call 1-800-MEDICARE if you have questions, or reach out to your Medicare SHIP, SHIP. There's one in every state where they can give you some advice and information on what other options are available to you.
Thank you, Louise. And to everyone listening or watching, you have until January 15th to sign up for health insurance through the Affordable Care Act at healthcare.gov. And you have January through March to change your Medicare Advantage plan through the Medicare Advantage open enrollment period. So thank you for joining us today for Care Talk. Please text or call in your questions for future episodes at 202-838-6837. And be sure to join us next week to hear more about veterans healthcare and what could be at risk next year. And be sure to subscribe to my channel or podcast wherever you get your podcasts. And this is Care Talk.